Good morning, I'm Patricia Bonsu. I'm here to talk about coronavirus as a contemporary issue impacting the healthcare in 21st century. In the history of the World Organization, there has never been a global health catastrophe like coronavirus COVID-19, classified as pandemic by the World Health Organization in 30th of January 2020 and classified as a global pandemic on 11th March 2020. The elderly and the disabled, the children, continue to be impacted by the COVID-19 pandemic. The COVID-19 is one of the contemporary issues that has hit the global with a lot of disturbing in every sectors of the economy, including the health and the social care sectors. The first case of the novel human coronavirus diseases, which eventually spread in the origin of the world, become the fifth known pandemic since 1918 flu pandemic, were reported in Wuhan, China in 2019. Although the UK economy did not grow as much as it has had before the pandemic, it was still making a slow but steady progress in the right directions. Many of the high-income world has adopted new measures to incubate the COVID-19 pandemic, adjusted the health and care system to handle the resulting stressing. COVID-19 has affected people's health, increased backlog in medical care, and the alarming the death toll. The COVID-19 pandemic may potentially worsen inadequate and discrimination and worldwide unemployment if it is not effectively addressed through legislation. As a key perspective and the impact on the care delivery in the UK, since people get sick, whether good or poor, the economic circumstances, there has always been a demand for medical treatment. People who have health insurance are still able to afford to receive high quality care because their out of pocket expenses are covered with healthcare insurance. And as a key perspective and the impact on care delivery in the UK economy, the COVID-19 pandemic has affected, since there have been age maintenance, physical distances, and limit their out activities. Many who would have otherwise medical attention are now paid, opting to stay at home instead. The health and the professional salary were affected by the COVID-19. NHS were under resources at the peak of pandemic and affected by the resources of the NHS. And the key perspective and the impact of the care delivery in the UK, the NHS had to deal with the issues of the personal protection equipment. The NHS activities in the health delivery has been by the novel COVID-19 pandemic. Social care has been affected from the effect of the virus. Many users and their staff have been unprotected, critically vulnerable. The NHS entered the the NHS entered the epidemic with relatively few and beds and personnel. COVID-19 has so many activities, including providing quality healthcare to deserving individuals around the world. The NHS has been reorganizing to provide for the immediate equipment for those who are afflicted with the virus, whilst also providing reducing non-COVID-19 healthcare. However, there is a need to provide some measures to reduce the effect of the healthcare delivery. Measures to minimize the impact of the COVID-19 on the service delivery in the UK. There has been a program such as the importance adjustment to primary and community healthcare were into effect in March 2020. The incumbent infection, the